Hi everyone, Dr. Scott Theirl here, and I am excited today because we're going to talk about different tools for muscle pain relief, specifically myofascial release tools and kinesiotape, how they work, why they're important, and why they're great tools to have in your toolbox. But before we get started, I need you to do a couple things for me. I want you to smash that like button, subscribe to our channel, and hit that bell notification button so that you're notified every time we release a new video every month. Now, without further ado, let's teach you something new. Okay everyone, so we have moved from the initial intake desk and my personal desk into the exam and treatment room, and clearly we're sitting on a chiropractic adjusting table here that we've got all kinds of fun tools laid out for, and I want to explain some of them to you. But first I want to explain how I think about extremity joints, because so often people feel like they just have some degeneration in there, and they might have an x-ray, an MRI, or a CT of a joint that shows that the actual cartilage within that joint, or maybe the bone that makes the joint up, is starting to change and degrade. And that is possible. But so often, at least in my office, patients say, I have x-rays, I have imaging, it looks fine, why does it hurt and feel arthritic? We got to figure this out. I'm too young for this, I'm not putting up with it. So when you think about joints themselves, right? You have the actual joint itself, the bone with the cartilage that's in between it, and it's possible that that bone or that cartilage is damaged. If it's red, inflamed, swollen, and sore, you probably want a picture of it just to see what's going on with it. But oftentimes you start poking around the actual joint and examining it and looking at its range of motion, and it looks like the joint itself is in pretty good shape. So then you have to think bigger. And what I mean by that is, what else surrounds that joint that makes it move? Around the joint itself, you actually have ligaments that hold the bones together so that the bones are where they're supposed to be, right? And holding cartilage in between them so that they don't dislocate all the time. And then you have tendons and muscles actually move your joints. So when we think about an extremity, we're always going joint, connective tissue like ligaments around the joint, right? And then we're going to go further and say muscles and tendons even further. What moves it? And I will tell you that time and time and time again, people who go, I've just got that arthritic knee. I've always had pain in that ankle. If you work on the muscles and tendons that actually move that joint, which usually are in a slightly different area than right where the joint is, even though the joint feels arthritic and achy and painful and stiff and weak, you will help that joint dramatically by helping loosen and eventually strengthen the muscles. Now, occasionally you do find a fixated joint, right? And that's where chiropractors shine. We're trained in joint manipulation and adjustments of any joint on your body. We can make a lot of joints move in great ways, and you will get instant relief if it's just a simple fixated joint. But with extremities, it's usually soft tissue with muscles and tendons and sometimes ligaments as well. And if you do all of these together and assess all of these areas and support all of these areas, you speed tissue healing so much faster, meaning less office visits, and you get over your pain quicker. Now, there's all types of manual therapy tools, right? And this particular one is by Rock Tape. It's called a Rock Blade. And it can actually work on nice large muscle groups, or you can use the other side and go deep in your hand. I tend to like to use my thumbs and hands better than I like to use tools, but for big muscle groups, like someone who strains a calf with a Charlie horse or a quad or a hamstring or something like that, the ability to hit so much tissue so quickly and really find those trigger points and loosen them up through real gentle cross-friction work, these are great. And you use lotion and you glide right over the skin and it doesn't hurt. It actually feels really nice. This is called The Stick. You can order it yourself at thestick.com. Again, they're not a sponsor in any way, but I've used these for 2 decades and they work great. They kind of look like a fancy rolling pin, right? But they're a myofascial tool. What does that mean? That means your muscle, myo, and fascia, connective tissue. And if you're rolling along, these guys actually open up a little bit. And you can use them on your legs and your quads. You can use them on your forearms if you tuck it underneath and really get in here. You can use it on all different fun muscles of your body. They're inexpensive, they work well, especially for larger muscle groups, increases blood flow, stretches tissue in just a nice different sort of way, helps with pain. So for people that have jobs, right? And I'm thinking about my job specifically because I use my hands all day long to help people. But I'm also thinking about things like anyone, whether it's a job that's like a cash register, whether it's an auto technician, where you are grabbing and holding and moving things all day long, so much of that hand stiffness tends to come from your forearms. These guys work great for that. This is kinesio tape. Kinesio tape is stretchy tape that's sticky that's designed to go on your body. And what you may or may not know about kinesio tape, and this also happens to be the Rock Tape brand, the adhesive seems to work very well for people. It stays on for days, doesn't cause skin irritation, at least in my experience. So I do like that brand. And again, with tape, it has two different ways that you can primarily use it, and this is kind of neat. So I'm going to take this, we're going to tear the back of it, and we're just going to rip it. And you're going to see that it stretches. You see how much that stretches? Now, it really only stretches one way. It doesn't stretch this way. There's no lateral stretching to it. It doesn't go. It's only longitudinal in nature. Now, it could stretch a little, 25%, 50%, or you can go all the way out to 100%. If you stretch it really hard and put it on a muscle, it's going to activate the muscle that's underneath it to contract at a higher, faster rate, thus giving you strength. But so often with pain, that may not be the best idea. Usually we need to do a little bit of loosening, deflame the area, decrease the pain in the area, and then work on some strengthening, right? So if you stretch it at just 25% of your stretch and put it on, what happens is it actually pulls your skin up away from your connective tissue just a little bit, and it leaves just a little bit, even if an extra millimeter underneath that skin, that subdermal area where that fascia connects, and it allows, again, more blood flow, more lymphatic drainage, and it helps deflame the area and deswell the area. A lot like ultrasound, but this stays on for days. It's a passive therapy. It's very comfortable and breathes well. It'll stay on in the shower for a couple days. You can even put topical ointments on top and it won't ruin it. So if you have something like an icy hot that you love to use, that would be fine. And it soaks in and stays on and it works well. So that's another passive therapy. So we use all these in the office. These are some of the tools we use along with adjustments to help shoulders, elbows, hands, wrists, hips, knees, ankles, and feet. It's a good summary of tools. I love my tools. They work great. I love technology to help things, right? You've always heard me talk a lot about brain rehab, and you've seen some of the various brain rehab techniques that we use. We get to talk about extremities today. All right, everybody. Well, that is it for today. If you enjoyed this video, go ahead and smash the like button, hit the subscribe to our channel button, and the bell notification button so that you're notified when we release new videos on various topics. And while you're at it, be sure to check out some of our other videos on our YouTube site as well. They're filled with information on musculoskeletal care, various functional and integrative medicine topics, as well as neuro rehab. And with that, thank you for your time. I appreciate it greatly. Wishing you your very best body, your best brain, and your best life. Take care.